Officers have confirmed that the death of popular radio personality Kidd Kraddick was cardiac related.
The news has shaken those within his broadcast family here in East Texas. CBS 19's Jamie Garrick joins us with how he's being remembered by those who knew him personally. Jamie.
You know, thousands of East Texans started out their day listening to Kidd Kraddick's show, which was broadcast over Mix 93.1. Not only was he a major part of the local station here, he actually helped jumpstart the career of somebody who works inside this building, who calls him a member of the family.
It's a true loss for the industry. It's a true loss for the listeners of his show.
Mix 93.1 DJ Lucky Larry worked under Kidd Kraddick in 1995 while he was an intern.
I was just devastated.
After hearing of Kraddick's passing, he took a trip down memory lane, playing old segments.
Going through old tapes and stuff from when I was an intern up there, I found it, and it's like, I've got to share that today.
They call him Lucky Bud. We swear he's not a dud. If you rub it, you might win some cash.
Larry says he's seen Kraddick when he's made stops in Tyler for the Women's Night Out benefit and describes him as generous.
He's energetic. Of course, he always made fun of him being ADD and that kind of stuff.
Kraddick's foundation Kidd's Kids sends terminally or chronically ill kids to Walt Disney World with their families. Larry estimates more than 35 families in our area have gone over the past 12 years. And many say that Kraddick's legacy is going to live on in the form of his foundation, Kidd's Kids, and Mix 93.1 is still accepting applications before the deadline on Friday. If you'd like to nominate a child or somebody in your own family, we're going to have that information posted at CBS19.tv. Click on the hot button and then search under Monday. In Tyler, Smith County, Jamie Garrick, KYTX, CBS 19 News. Back to you.
A lot of people love Kidd Kraddick for sure.
They did. He'll be missed.
Thanks, Jamie. And right now, Mix 93.1 is running Best of specials paying tribute to Kraddick.
And they will do that until the show figures out what its next step is and how they will move forward from this.
Again, the Louisiana coroner says Kraddick's sudden death was cardiac related.
The coroner says Kraddick had an enlarged heart, blocked arteries, and probably developed an irregular heartbeat.
Local cardiologist Dr. Oscar Paniagua joins us now. And Dr. Paniagua, obviously Kraddick was only 53. He didn't look overweight. How does something like this happen?
Well, obviously he has developed these blockages in the coronary arteries and an enlarged heart, and probably did not have any symptoms prior to this, so he never looked, sought any medical attention.
But usually there's some kind of signs that can warn you that you have a major cardiac problem like this coming up. So, warning signs?
Well, if you have an enlarged heart, you may have some shortness of breath or swelling of your legs or things like that. But in general, sudden cardiac death, by definition, is something that happens suddenly. It just gets your life.
How do you prevent something like this? What do you do?
Well, I tell my patients, if you have a genetic background, a family history of heart trouble, either blockages or arrhythmias, you need to seek attention very early in life. But if not, you need to know your risk factors. You need to know if you have diabetes or not, blood pressure, cholesterol problems. You need to have a healthy diet, exercise, don't smoke, don't drink alcohol in excess, don't do drugs. There are a lot of things that you can do to prevent the developing of these problems.
Let's talk a little bit more about that, because Kraddick is proof that you're never too young to get these screenings. So what screenings are there? What should you be tested for? How often?
Well, the screening can go from a simple blood test to see if your cholesterol is high or you have diabetes, to more sophisticated testing like stress tests, or some calcium scoring tests that we do, or many other more, echocardiograms to see if your heart is enlarged or not. It varies depending on your age and your risk factors and so forth. But very important you see your doctor.
Yeah, there were some reports he may have had some chest pain a few days ago. So I guess bottom line, if you're not sure, get it checked out.
Yeah, get it checked out.
The sooner the better. Okay, Dr. Paniagua, thank you. Life-saving information there, and we appreciate it.
Thank you.